We will now begin the scientific program with a conversation titled Policy and Advocacy in European Health Policy, Why It Matters for Researchers. It is designed to introduce some of the key themes that will run throughout the day and to explore how scientific evidence contributes to shaping health policy, implementation, and public health priorities across Europe. Please welcome Kitti Almer, Cardiopolicy Consultant working with the European Society of Cardiology, and Héctor Bueno, a researcher at the CNIC and a member of the Spanish Cardiovascular Health Strategy Development Committee.
Thank you very much, and a very good morning for everyone. Thank you also for the brief introduction. And hi, Hector. Very nice to see you and to share a stage with you. And I'm very excited for our conversation, which will aim at making you understand why is actually science not so different from policy and why it is actually not so distant from each other. And we can learn from a lot from Hector, I believe. So,
from you.
I will try my best as well, of course. So Hector, I wanted to ask you as a very first question. There may be a misconception that science and policy are just two different worlds. Why it is actually important to understand policy and advocacy, and what does it mean in a practical level?
Well, they are two different things. The most important thing for researchers to understand that they overlap. I mean, part of the action falls on the evidence. There's some of the misconception is this policy thing is about lobbying. Of course, there's lobbying, but there's much more than that. And actually, the most solid part of advocating is setting the evidence. This is so critical importance, and the evidence comes from research. So I think it's the step of moving from evidence to, let's say, decision making. So thinking of what is found in research actually is applicable in the society, how it can benefit. I mean, we're talking about cardiovascular health, not only disease, but also health. So it's setting this evidence and, I mean, thinking how these findings from research is usable, can be applicable to the society. And that actually needs a little bit of mindset changing in researchers, because it's important to create this narrative of why this is important, how this can actually benefit the population. That, of course, in clinical research is easier. Sometimes basic research needs to change a little bit the mindset. And that actually sets on the aspects that what is policy. Maybe you can actually tell us, because you're more an expert of what is really policy. I mean, it's kind of law, but it's not law. How would you define this for researcher here to understand what is policy and why it is relevant for researchers?
Policy is a direction. It actually gives you where politicians are actually looking at in the field of science, for example, cardiovascular health. It's soft law. It means that if you are not following policy, there will be no sanctions. Same goes for the Safe Hearts Plan, for example. It's a direction that it sets the political agenda. And once the political agenda is at something, usually funding, attention, strategies, and other research communities are actually following. So that's usually the first step, how politicians are putting the agenda, how politicians are setting on the agenda, and how health is actually becoming more and more important, especially cardiovascular health, since 2024.
But for that, they need to understand the priorities.
Indeed.
So that is one of the key points, how we explain to them what are the priorities and how we, in a way, drive these decisions based on evidence. I think that's a game.
Of course. When I was a policymaker myself, and that may not be known for everyone, I was a diplomat in Brussels before I was the public health attaché for 2 years, and I was driving the public health priorities for the Hungarian presidency. And that's how I know how research actually enters policymaking. Many, many groups were coming to us before the presidency, how evidence is actually showing what we are supposed to do. And there is one thing, that is evidence. And they've showed us cardiovascular health is being left behind for 20 years. No one has even touched it on a political level. Now it's Hungary's time. And we did it. That was the same for transplantation and organ donation as well. We have following evidence. However, of course, this needed luck and timing. So that also from Budapest, from our capital, they agreed so that the political priority could be set on the agenda with the approval of higher political leaders like the minister and from the state secretariat from the previous government of Hungary. So that was also not only that the evidence was needed, timing was very necessary here. So next question, because we have been following up on this a very long time, what can actually researchers do to make their work policy relevant? What do you think?
Well, it's basically setting a meaningful evidence. So there's many ways. There's, clinical, of course, randomized trials, let's say the core of evidence-based medicine, but as the many other aspects which are relevant. And actually, clinical registries, guidelines, ESC is an institution famous for the solidness of the guidelines. Guidelines are very important for decision makers. But there's other aspects like cost effectiveness aspects, because cost will always be part of the equations in decision making. But expert groups, now more and more the voice of patients, of citizens heard, not only in science, in the European Society of Cardiology, but also in the Parliament. I can see that it's absolutely important. We have some people from Jakarta. Joint actions are very important. And now the European Commission actually gives a lot of voice to the experience and the activities of joint actions and these activities that are put in practice in real life, public consultations. So, but maybe one important thing is not only what you do, is how you communicate it.
Oh, that is very important.
Yeah,
Indeed,
well, tell us about that, because probably you receive an avalanche of evidence, of people coming saying what I'm saying is important. How does it impact you and this decision making in this priority setting?
Can I understand it under 2 minutes? That's basically the question when you're a policymaker. If I do get a really long research paper that is very well written, very scientific, and beautifully made with fantastic and tasteful, colorful pictures, I don't have the time to read that, I'm sorry, as a policymaker. It's fantastic, and if I'm really interested in that topic, as a researcher myself, maybe because I was also part of academia for a while, I'm going to read it. But at the decision-making process, you need to package it well. It needs to translate into the language that policymakers can actually speak. Scientific background for a policymaker is rare, but not uncommon, of course. And they are going to understand this language, but for me, for example, understanding what is the clinical background of very specific cardiovascular diseases, I won't be able to understand it without your help. You need to be able to translate it into my language, if we are speaking to me as a policymaker. It needs to be able to be read in 2 minutes. 5 minutes, and giving me the idea that there is a problem, there is evidence for that problem, there is suggestions what to do with that problem, and there is support for that problem as well.
Well, I think that's a critical message. We have sometimes, we've been so used to write a manuscript, which is usually what they consider in our career and for funding. So, but scientific manuscripts are not very good for policy. Of course, they set the evidence, but we have to write it in a different manner to impact decision making. It's to set what is the impact, clear messages, short messages, policy brief. So there's a completely different way of putting the evidence in a very clear, meaningful, and impactful way for the decision makers to set the priorities. This is really important. This has real impact, and so on. And that's something that we've not been so used to, particularly the most pure scientists.
Yes,
I think that's very good, very important point.
Indeed. And Hector, I believe that the 10 minutes that we have had has been going so far. We had so many more questions that we actually wanted to discuss and would love to do that. But unfortunately, we have to move on. And thank you so much, Hector, for this lively conversation.
Well, thank you, Kitti, for being brilliant for everyone.